So, good day, sir. So, for today, I'm going to discuss about Lesson 1, Recognition of Normal Labor. Labor. Labor is the term for the changes in anatomy and physiology in the female reproductive tract that prepare the fetus and placenta for delivery. So, labor heralds the end of the baby's time in the uterus and the beginning of adaptation to life outside the mother. It is a coordinated sequence of involuntary intermittent uterine contraction. So, ang labor is muna ni siya ang mahitabo or ang pagbati sa mama before the delivery of the child. We also have factors affecting the interpartum experience, which is first the experience, culture, pre-pregnant health and biophysical preparedness for childbearing, motivation for childbearing, socioeconomic readiness, and of course the age of the mother. So for the experience, needs sa mother, of course ang experience needed siya sa mother kay para ma-ready ang iyaang body for para sa pagdala sa baby. Kay kung wala siya experience, maglisod ang mama paun sa pagdala sa baby sa womb pa lang niya. And the next is culture. Of course, maka-affect pod ang culture sa interpartum or sa pagburos sa mama kay we have in each one of us naman tay mga tinuuhan nga like ang mama kay palitan if ang mama dili siya pwedeng or naiuban ang kanang private part sa ato ang as babayi basin na ay dili pwede sa ilaang or i-check ba and then maapektuhan pod kay sa ilang culture man gud basin na ay dili pwede nga mauntay dapat buhaton para matarong ang pagburos sa mama. And then next is pre-pregnant health and biophysical preparedness for childbearing. So muna ni siya, pwede ni siya nato ma-connect sa age of the mother kay ang age sa mother pwede siya makaapekto kay basin kulang ang kakuan sa mama basin ang edad is murag dili pa siya dapat nga sa magburos or kulang pa ang edad nga dapat ang stage nga magburos ang mama. And then motivation for childbearing. Of course, naapod ang motivation kay if ang mama dili siya ganahan sa iya ang pagburos or wala siya motivation nga alagaan ang iya ang baby, pwede nga makuan ang bata sa tiyan pa lang sa mama. And of course, the socioeconomic readiness kung ang mama is dili pa prepared para sa mga financial needs para sa baby, maka-affect po siya. So, the indefinite labor or the indefinite nature labor, we need to be aware that labor may start at any time. So, ang pag-labor sa mama, pwede na siya mahitabo bisan unsa nga time or pwede po siya anywhere basta nana siya sa due date sa paghatag sa iyaang doctor. Kung due date na niya anytime, pwede na mo start. And then we also have the theories of labor onset. Theoretically, labor is thought to result from, we have uterine stretch theory. This is the hollow body organ when stretched to its capacity will inevitably contract to expel its content, and the pressure increases causing uterine contraction that initiate labor and results in release of prostaglandins. The next is napudtay oxytocin theory. Oxytocin theory is pressure on the cervix by the growing fetus stimulates the hypothalamus to release oxytocin from the maternal posterior pituitary gland. Presence of this hormone causes the initiation of contraction of the smooth muscles of the uterus. So ang contraction is mag-push na siya. Nanay contraction nga mahitabo. The next is progesterone deprivation theory. The progesterone is the hormone designed to promote pregnancy. This inhibits uterine motility. Ang progesterone is masikret siya to prevent uterine contraction nga ma-disturb ang growing embryo. Of course, kani pong progesterone is mag-prepare po siya sa breast lactation para sa baby. The next is theory of aging placenta. Then, fetal cortisol or fetal adrenal response. And the next, naputay initiation theory, prostaglandin cascade theory. So, ang theory of aging placenta, muna siya ang advanced placental age of decreases blood supply dito sa uterus. So, kani siyang event is makatrigger ni siya sa uterine contraction para mag-start na ang labor. And then, ang fetal cortisol, kay if ang pregnancy is ma-reach na its term, so the fetus produces more cortisol, which causes slowing production of progesterone and stimulate the production of prostaglandins. The next is prostaglandin cascade theory. Labor onset is initiated due to the production of prostaglandin as a result of interplay between adrenal, fetus, and uterus. This helps the increase on calcium flow in cells, which strengthens contraction production of prostaglandins lead. So sa coitus pod, coitus is semen contains prostaglandins that helps ripening of the cervix. And then ang pressure on cervix, this stimulate neural release of oxytocin. And then, of course, the seasonal time influences, for example, ang mga kanang full moon, low and high tide. Seasonal time nga maka-influence. So, normal labor. Phenomena and process of labor and delivery. Labor is a coordinated sequence of involuntary intermittent uterine contractions. And then, ang delivery is the actual event of birth. So, ang delivery is muna siya ang pagawas na sa baby, dahil ang labor is kamulo pa nga pagbati sa mama or na siya ma-feel nga contraction sa iya ang tiyan kay padulong na mugawas ang baby. So, nanadapit sa cervix. Then we have also common nursing diagnosis. Common nursing diagnosis used during labor. This generally relates to a woman's reaction to labor, pain related to labor contractions, anxiety related to process of labor and birth, situational low self-esteem related to inability to use prepared childbirth method, health-seeking behaviors related to management of discomfort of labor. So, although the discomfort of labor contraction is commonly referred to as a contraction rather than pain, from a nursing diagnosis, because the term strengthens and understand of the problem as well as alerts a woman, she should feel free to ask for something for pain at the point she feels she need additional help. So, kani siya nga common nursing diagnosis mo ni ang mabatian sa mother kung mag-labor na siya. So, na siya mabatian nga pain, kay mo na may mahitabo diri nga contractions. Then, apon siya anxiety nga mag-relate sa pag-labor na niya and birth, situational low self-esteem, then health-seeking behaviors related to management of discomfort of the labor. Then characteristics of normal labor. So we have spontaneous onset. It begins on its own without medical intervention. Then we have rhythmic and regular uterine contractions, vertex presentation, which the crown of the baby's head is presented to the opening of cervix. So muna ni siya nga ang baby, ang head sa baby is nanadapit, nag-atubang na sa cervix sa mother. And then of course, vaginal delivery occurs without active intervention in less than 12 hours for a multigravida mother, and less than 18 hours for a primigravida mother, so first birth. No maternal or fetal complication. The next, we also have the components of labor. First is the passage. So ang pelvis is of adequate size and contour na siya. So nasa sakto nga size and contour ang passage. Then we also have the passenger. Of course, the passenger is the fetus. So sakto na pod ang size, position of presentation sa fetus. So kung sakto na ang size, position, and presentation, muna ni siya nga naanay contraction nga mahitabo kay ang baby or ang fetus is mugawas na siya kay ang yang head is nag-atubang na sa cervix sa mother. Next is the power. Uterine factors are adequate. And then we have also the psychological state. Then the position. The position is the position of the mother, ang accurate or sakto nga position sa mama para sa pagpagawas na sa baby. Dapat na siya sa sakto nga position para dili maglisod inig pagawas na. And then we also have the placental site of implantation. So the passage have 4 parts. First is the gynecoid, platypeloid, android, and anthropoid. This refers to the route a fetus must travel from the uterus through the cervix and vagina to the external perineum. So ang gynecoid pelvis is oval at the inlet, has generous capacity and wide subpubic arc. This is the classical female pelvis. Pelvic brim is a transverse ellipse, nearly a circle, most favorable for delivery. So, ang gynecoid nga passage is mas favorable para sa delivery. The next is the platypeloid. Flattened at the inlet, has a prominent sacrum. Only about 3% of women have a true and pure pelvis of this type. It's very difficult for these women to have really flat abdomen. So for the android, the pelvis is like a gynecoid pelvis, basically oval at the inlet po siya, but the long axis is oriented vertically rather than side to side. Subpubic arc may be slightly narrowed, and then this pelvis favors occiput posterior presentation. So much more common in Black women. So ang android is more favor siya sa Black women. The next is the passage. The passenger is the fetus. The body part of the fetus that has the widest diameter is the head. So this is the part least likely to be able to pass through the pelvic ring. So if ang baby is mugawas na sa cervix, most likely nga ang ulo jud mo'y mag-una pagawas. Then we have also the diameter of the fetal skull. So sa vertex presentation, naa dire 9.5 centimeter ang pataas, and then kung sa palapad na siya 9.25. For the Senkiput presentation, 12 centimeter 9.25 pod. And then sa Bro presentation, so 13.5 centimeter 9.25. So sa vertex is murag ang makita pa lang is ang nakagawas pa lang is ang sa likod sa ulo sa baby, and then sa iyang agtang dapit. Then sa Senkiput presentation is ibabaw gamay sa Bro, and then likod sa ulo ang murag na makita na sa murag nagawas na. And then diri sa Bro presentation is ubos na sa Bro, dayon palikod na ang murag nagawas. So for the fetal attitude, good attitude is this usual fetal position is advantageous for birth because it helps a fetus present the smallest anteposterior diameter of the skull to the pelvis, and also because it puts the whole body into an ovoid shape, occupying the smallest space possible. And then for the moderate flexion, this position causes the next widest anteroposterior diameter, the occipitofrontal diameter, to present to the birth canal. Sa partial extension, presents muna siya ang makita na ang brow of the head to the birth canal. Complete extension, this is unusual position, usually present too wide a skull diameter to the birth canal for the vaginal birth. So here is the image for the diameter. So for the fetal lie is the relationship between long or cephalocaudal axis of the fetal body and the long cephalocaudal axis of the woman's body. In other words, whether the fetus is lying in horizontal transverse or a vertical or longitudinal position. Longitudinal lies are further classified as cephalic, which means the fetal head will be the first part to contact the cervix or breech, with the foot or the buttocks as the first portion to contact the cervix. Longitudinal lies is classified siya as cephalic, meaning ang head sa fetus kay mo ay first nakakontact sa cervix. So, nara ang longitudinal lie or vertex presentation. Mani siya. So, ang head, so cephalic siya. Ang head mo nakakontact sa cervix, and then longitudinal lie. Breech presentation po siya kay ang buttocks mo ay nakakontact sa iyang cervix. And then, kani, transverse lie, shoulder presentation kay murag ang baby nakababag siya. So, fetal presentation, this refers to the body part that will first contact the cervix or be born first. And it is determined by combination of fetal lie and the degree of fetal flexion or attitude. So, cephalic presentation, na siya types, na siya vertex, brow, face, mentum. Sa vertex, the head is sharply flexed, making the parietal bones or the space between the fontanelles is presenting part. So, mo ay naka-present. Sa brow pod, because the head is the only moderately flexed, the brow or the Senkiput becomes the presenting part. Ang presenting part niya is ang brow pod. Sa face, the fetus has extended the head to make the face the presenting part. So naka-extend na siya para ang face na pod niya mo'y presenting part. Sa mentum, the fetus has completely hyperextend the head to present the chin. So naka-hyperextend, then ang presenting na din niya is ang chin. Fetal presentation, for the breech presentation, either the buttocks or the feet are the presenting part. So na siya types pod, complete, extended, footling, kneeling, and others. So na siya ang picture. So sa complete, ang baby kay nakasit siya cross-legged with flexed knees and hips. Ang feet niya is naka-tuck up against sa iyang bottom. Then mo ni siya most common sa multigravidae. And then extended or front breech. The baby's leg are flexed at the hip but with straight knees. Naka-straight pod ang iyang knees. The legs lie alongside the trunk. And then sa footling, one or both knees and are extended with one or more feet below the buttocks. So nakapatindog pod or ang both niyang legs, knees, kay naka-extend. Sa kneeling, one or both hips are extended and the knees are flexed. The knees are at the height or below the buttocks. So dara makita. Ang yaang knees is below sa buttocks. And sa other spot, occasionally, a presentation may be compound. So dire, pwede nga mag-iponan. Example ani, one leg naka-footling and the other naka-extend. So, fetal presentation for the shoulder presentation in a transverse lie, a fetus lies horizontally in the pelvis, so the longest fetal axis is perpendicular to that of the mother. The presenting part is usually one of the shoulders or the acromion process, an iliac crest, a hand, or an elbow. We also have the types of fetal position. Position is the relationship of the presenting part to a specific quadrant or woman's pelvis. So ang types niya is right anterior, right posterior, left posterior. And then ang yung landmarks, vertex is occiput, face sa chin, then mentum, then napod tayo breech, which is the sacrum, shoulder, scapula, or the acromion process. Middle letter denotes fetal landmark. So ang tunga nga mga letter is nag-denote siya sa occiput, mentum, or chin, sacrum, acromion process. Ang first letter pod nga mag-define siya whether the landmark is pointing to the mother, right or left, kung asa naka-point ang landmark, or asa naka-point ang sacrum, ang acromion process, ang occiput. Then the last letter defines whether the landmark points anteriorly or posteriorly or naka-transverse siya. So, ROA or LOA position. So, ang ROA or LOA position, born fastest. Then, kaning ROP or LOP, extended labor, muna siya more painful kay kani right occiput anterior or left occiput anterior, mo siya may dali nga ma-burn or magawas bitaw. And then sa right occiput posterior or left occiput posterior, mo siya more painful. So position is important because it influences the process and efficiency of labor. So, importante ni siya kay mo ni siya basis kung ang pagpagawas ba sa baby is dali ra or more painful para sa mother. So, natay mga possible fetal position dire sa vertex presentation. Natay left occipito anterior, left occipito posterior, left occipito transverse, right occipito anterior, right occipito posterior, and right occipito transverse. And then sa birch presentation pod, left sacroanterior, left sacroposterior, left sacrotransverse, right sacroposterior, right sacrotransverse. And then sa shoulder pod, left scapulo-anterior, left scapulo-posterior, right scapulo-anterior, right scapulo-posterior. So, muna ni siya ang example. Left occipito-posterior, ang first nga image. Left occipito transverse, left occipito anterior, right occipito posterior, right occipito transverse, and right occipito anterior. So, occipito siya kay head man mo yung nakakontakt sa cervix. Then, asa pod nag-point. So, next is mechanism of normal labor. First is the engagement. When the fetal head enters into the pelvic inlet. So, may siya image. The head is said to be engaged when the biparietal diameter or measuring ear tip to ear tip across the top of the baby's head. So naka-engage na. Kung ang biparietal niya kay ear tip to ear tip across the top of the baby's head. So sa descent pod, the term fetal descent is used to describe the progressive downward movement of the fetal presenting part. Most commonly ani kay ang head dito padulong sa pelvis. So molding, the fetal scalp bones undergo overlapping at the suture lines in order to allow the head to pass through the narrow space. The commonest types of molding include one parietal bone overlapping over the other part bone along the sagittal suture, the occipital bone overlapping the temporal bone, and the frontal bone overlapping the parietal bones. So sa flexion, the movement known as flexion occurs during descent and is brought about by the resistance felt by the baby's head against the soft tissues and bones of the mother's pelvis. So next is internal rotation. As the head reaches the pelvic floor, it typically rotates to accommodate the change in diameters of the pelvis. At the pelvic inlet, the diameter of the pelvis is widest from right to left, and the pelvic outlet, the diameter is widest from the front to back. So, extension, after internal rotation is complete, the baby's head passes through the pelvis, and a short rest occurs when the baby's neck is under the mother's pubic arch na. And then external rotation, after the head of the baby is born, there is slight pause in action of labor. During this pause, the baby must rotate so that his or her face move from facing the mother's backbone to facing either of her inner thigh. So expulsion, almost immediately after external rotation, the anterior foremost shoulder moves out under the pubic bone. The mother's perineum becomes distended by the posterior or second shoulder, which is then also born. So muna siya ang image. Power of labor. Phases of uterine contraction. Kani siya phases na po din sa uterine contraction. First is increment, when the intensity of the contraction increases. So ang intensity sa contraction nagkataas. So next, acne, when the contraction is at its strongest. So kung nikusog na ang iya ang contraction, kung mas musakit na siya. Decrement, when the intensity decreases. So ni ubos na pod ang yang intensity sa decrement. The next, sa contour changes pod, as labor contraction progress and become regular and strong, the uterus gradually differentiate itself into two distinct functioning areas, the upper portion and the lower segment. So sa upper portion, which thickens, and then sa lower segment na become thin-walled, supple, and passive, so the fetus can be pushed out of the uterus easily. So there is a lower segment, thin-walled siya, musapple, and passive, so ang fetus is maka-push siya pagawa sa uterus. Mas dali na dayon. And then sa cervical changes, effacement is shortening and thinning of the cervical canal. So murag mugamay siya. So for the dilatation, dilatation is murag mu-wide na siya or mu-enlarge ang cervical canal. So ang dilation is murag na siya magsugod siya sa gamay padulong sa dako nga centimeter, which is para allowed na ang baby nga makagawas. The next is, how do you know that true labor has begun? So true labor is characterized by regular, rhythmic, and strong uterine contraction that will increase progressively and cannot be abolished by pain anti-medication. So ang labor is dili lang siya nga madali-dali og hatag og anti-pain medication. Kay because ang labor natural yun na siya nga naay nga musakit or naay siya strong contraction para man mo enlarge ang cervical canal sa mother. So naputay adequate uterine contraction. So ang frequency 3 to 5 times in every 10 minutes period. So kapila siya sa sulod sa 10 minutes. Kapila siya ni balik. And then duration sa each contraction niya kapila siya ni last 40 to 60 seconds. Ang yang intensity pod is kung kusog ba siya or sakit na ba kaayo. In the last few days of pregnancy, the cervix may begin to open, sometimes the mucus and a little bit of blood drip out of the vagina. This is called show. It may come out all at once like a plug, or it may leak slowly for several days. When you see the show, you know that the cervix is softening, thinning, and beginning to efface. Or ni open na siya. So mo ni siya agkatong nanay blood or nanay show nga mugawas sa vagina. And of course, note that be careful not to confuse the show with the normal discharge or wetness from the vagina that many women have in the 2 weeks before labor begins. So sa OB-GYN or doctor sa mga buros, tudluan man po na sila sa ilaang OB kung unsay sakto nga discharge or wala ba sila nga normal lang to siya nga discharge sa vagina. True labor may be spontaneously established with or without show and with or without leakage of amniotic fluid. If labor has not started, also take note that if labor has not started or not progressed much within 6 hours after the water break or after nga nagawas na ang amniotic fluid or nanay water nga nigawas sa iyang vagina, i-refer na ang woman sa higher health facility as soon as possible. So characteristic, uterine contraction, cervical dilation, and pain. Ang true labor, ang contraction niya mo-occur sa regular intervals, but the interval between each contraction gradually becomes shorter. Duration of each contraction increases gradually, so magka-increase ang duration. Ang intensity po niya, magkasakit na siya or stronger and stronger. Muna siya mo true labor. For the cervical dilation, cervix progressively dilates. Modilate na siya or modako na ang sa cervix niya. Magkadako siya. And then pain, discomfort at the back in the abdomen cannot be stopped by strong anti-pain medication. So ang pagsakit or discomfort mga mabatian sa mother sa likod or kanang dapit ubos bitaw siya kay dili siya madali-dali lang o wala sa anti-pain medication. So ang fake labor contraction occurs irregular intervals, so dili siya true kay ang contraction dapat regular intervals man. Ang duration po niya dapat duration remains unchanged. So fake ni siya kay ang true labor mag-change siya or mag-increase siya gradually. Then kung ang intensity po niya kay remain unchanged or gihapon, dili na siya nga true labor. Kay if ang intensity sa labor is magka-strong and magka-strong. Cervix does not dilate, remains less than 2 cm. So fake because ang cervix is magka-dilate siya, magkataas ang centimeter. Discomfort is non-specific. Wala siya particular location. So sa true labor, if ang mama kay mag-labor na ay specific na magsakit or discomfort, which is sa back of the abdomen. And then, helping a mother recognize true labor. Kani siya, there is no way to be sure when a woman's labor will begin. Are some signs that it will start soon. Lightening. So lightening, babies often drop lower in the mother's belly about 2 weeks before birth. The mother's stool may change or little show, or the bloody mucus may come out of the vagina. The bag of waters leaks or break, or the premature rupture of fetal membranes before labor begins. So the psychological outlook refers to the psychological state or feelings a woman brings into labor. For many women, this is a feeling of apprehension or fright. For almost everyone, it includes a sense of excitement. Women without adequate support can have a labor experience so frightening and stressful that may develop symptoms of post-traumatic stress disorder. So, sa psychological pud sa mother, dapat na siya sakto nga support nga mo encourage sa mother. Kay if wala, pwede ni siya nga maka-cause of frightening and stressful siya na maka-develop og symptoms sa post-traumatic stress disorder or PTSD. So what will we do if mag-labor na ang mama? So first, encourage women to ask question at prenatal visit. So dapat mangutana din sila unsay buhaton. And then mag-attend pod siya og preparation for childbirth classes like sa mga position, unsay dapat position inig mag-labor na. And then encourage them after birth to talk. Next is stages of labor. Natay first stage, second, third, and fourth. So sa first stage, the cervical opening stage. So dire ang cervical niya kay magkuan na siya, opening na. Characterized also by progressive opening of the cervix, which dilates enough to let the baby out of the uterus. So mag-dilate na siya. So munin siya ang magkahinay na og kadako ang centimeter sa pag-open sa cervix. And the next is the second, the pushing stage, ending in the birth of the baby. So muna ni siya ang birth sa baby. Paggawas na sa baby. Sa third stage pod is birth of the placenta. So ang paggawas na sa placenta or inunlan. Fourth stage of the labor, the first 4 hours after birth. So unang upat ka oras paghuman pagpanganak na sa mama. Muna siya fourth stage. So first stage of labor na ay effecament, the cervix stretches and gets thinner. Nani siya duha ka phases, the latent phase and active phase. So sa latent phase is the period between the start of regular rhythmic contractions up to cervical dilation of 3 cm. So nanay regular contraction, mag-start na ang regular contraction. Then nana po din siya cervical dilation of 3 cm. Then active phase, when cervical dilation occurs more rapidly. So magsunod-sunod na siya ang pag-dilate. Mo-increase na siya from 4 cm to 7 cm at a rate of about 1 cm per hour. So kada isa ka oras, mukuha na siya og 1 cm. Ang dilation niya 1 cm na. And 2 cm per hour in multiparous. Cervical dilation, the cervix then dilates, the diameter gradually increases. Ang diameter niya magkadako na. This has transition phase. Cervical dilatation continues until the cervix is completely open. A diameter of 10 cm is called fully dilated. So, magikan sa 1 until 10, kung maabot na siya 10 cm, so muna na siya gitawag og fully dilated na. So, pwede na siya ready na ipagawas ang baby. Okay, accurate na siya para sa kadakon. So, second stage of labor, the second stage begins when the cervix is fully dilated. So, muna siya nga pagpaanak na dayon is completely when the baby is completely born na siya. So, sa third stage of labor, the third stage of labor is the delivery of the placenta and membranes after the baby has been born. So, musunod na dayon, after maborn na ang baby or nakagawas na ang baby, musunod na dayon ang placenta. Delivery sa placenta o sa membranes. Sa fourth stage, muna na yung first 4 hours na immediately following placental delivery are critical and have been designated by some expert as the fourth stage of labor. So, manani siya first 4 hours after the baby or after sa delivery sa placenta.